Hello. This is a personal note to my patient who is struggling with some avascular necrosis of his lateral sesamoid. I wanted to let him know that surgery to remove the sesamoids are, in my knowledge, about 85% successful. Of those 85%, about 50% of people feel great, and 50% people say it's better, and I'm glad I went through the surgery, but there are still issues like scar tissue or tightness or issues to deal with. 10 to 15% of all patients, when they have their sesamoid removed, do not feel like it improved it. And in that case, you have to investigate why that happened, and what. Sometimes it's just they have arthritis in the joint, they have a bursitis, they have a turf toe, ligament tear. So all that you hope will have been worked on at the beginning before the initial surgery. And of course, 1 to 2% of any surgery like sesamoid patients feel worse, and sometimes that's because of an infection or excessive scar tissue, and some of these patients need an extra surgery. A lot of times the doctors will wait a year to make sure everything's healed and make sure things don't work its way out. So that's sort of the gist. I've seen in rehab many sesamoid injuries, and especially post-op. Patients come in all the time post-op and say, I don't feel good. And it's some simple things like the biomechanics of the patient that set them up for extra pressure. Like if you pronate your foot, it puts more weight on the sesamoid area, even if you've had surgery. And of course, so that tends to have to be worked out. There's a lot of things on my blog that will help patients decide what to do post-operatively in terms of conservative care. A lot of times is the same as before, in trying to avoid surgery. And I think one of the things is that if you remove the sesamoid, you still have to protect that, because there's another sesamoid there that's actually even more vulnerable now. So with high impact sports, you've got to have some sort of dancer's pad and orthotic to sort of shift weight and protect the area. And so there's still a lot of biomechanics and that you have to deal with. So I hope this helps answer your question. I know probably the Google is fraught with bad case scenarios, but and I try to avoid sesamoid procedures, but when they get to avascular necrosis and fragmentation, which is in your case, it usually needs surgical intervention, and then the rehab we just discussed. All right, I hope this helps you. Again, happy Thanksgiving for all U.S. citizens, and please be safe with COVID. Do not have large gatherings, please. Okay, bye-bye.